With that, again, we're concerned about some of the rise of the pandemic and the surges in infections in some of our communities of color. They have a higher incident of that taking place. So we'll have the opportunity to hear from Jake Batisi Manu, who's a West Valley City Councilman. He's the chair of the Utah Pacific Islander Health Coalition and is a member of our multicultural subcommittee of the Utah Coronavirus Task Force. And he's going to talk to us about this disproportionate and unique effect that happens on certainly the Pacific Islander community, and give us some counsel what we can do and what they can do, particularly to help curb the spread of this virus. So, Councilman Fitzy Manu, Jake.
Thank you, sir. I'm mindful that this is being translated into other languages in real time, so forgive me if I read or speak slower than I normally would. Amalo Ma'ailopa was a young man in 1918 when the influenza pandemic ravaged the Samoan Islands and killed 1 out of every 5 Samoans on the planet. He was among those who survived and were left to bury thousands of people in unmarked mass graves throughout the island. Today, 102 years later, his great-granddaughter, Luisa Auvaatupo, is a community health worker on the front lines of the COVID-19 pandemic right here in Utah that is claiming lives and disrupting livelihoods in her community. Bilingual, trusted by community, and trained in evidence-based public health, Luisa and her colleagues are uniquely poised to address this pandemic in our community in ways that government agencies or healthcare systems may not be able to. Luisa embodies the ingenuity and the resilience of generations of survivors like her great-grandfather. And those are traits that she shares today with tens of thousands of Pacific Islanders that call Utah home. Talo falava, faftaimon ne avanoa. My name is Jake Fitzsimanu, and I'm proud to be here today as the chair of the Utah Pacific Islander Health Coalition. For the last 2 months, Native Hawaiians and Pacific Islanders in the state of Utah have had the highest infection rate of COVID-19 and the highest hospitalization rate for COVID-19 in Salt Lake County, and the second highest infection rate and the second highest hospitalization rate in the state overall. The data that is shared here from this podium pretty much every day confirms that COVID-19 isn't impacting all groups with the same level of severity, and Native Hawaiians and Pacific Islanders are among the hardest hit in our state today. This pandemic has interrupted lifestyles, it's disrupted livelihoods, it's taken lives in our community, and every Pacific Islander family, congregation, and cultural group in the state has been impacted in one way or another. Many factors contribute to this disparity, including a high prevalence of underlying health conditions that make folks more susceptible to contracting and more at a higher risk of complications and hospitalization. We have housing and family dynamics that increase the likelihood of spread through large multi-generational households, increased likelihood of exposure due to essential employment in service industries and hospitality, manufacturing, and warehouse sectors, and cultural practices and customs that simply aren't aligned with the tenets of social distancing. Also, our Pacific Islander populations in Utah are geographically concentrated in some of the zip codes with the highest infection rates currently. For these reasons and others, our Pacific Islander community is at much greater risk of contracting COVID-19, at a greater risk of being hospitalized, and possibly succumbing to COVID-19. On behalf of over 47,000 Native Hawaiians and Pacific Islanders in the state of Utah today, we are asking our friends and neighbors to work with us throughout the state to help us stop the spread of COVID-19. We echo the calls of our cultural elders, of our family chiefs, of religious leaders and public health officers and civic officials in strongly emphasizing the need for physical distancing, for wearing face coverings in public, for good hygiene practices. The Utah Pacific Islander Health Coalition was formed 10 years ago as a resource hub for health promotion for Pacific Islander families and all of our neighbors. We have a dedicated team of trained community health workers and an extensive network of community partners with capacities to serve and help in Samoan, Tongan, Marshallese, and other Pacific Islander languages. This is not the first time our community has overcome adversity. This is not the first time our Pacific Islander people have survived a global pandemic. History shows that the island nations that enacted quarantine measures and implemented preventive public health measures were spared the terrible death toll that was experienced in Samoa in 1918. That's a very poignant lesson for us today. It's not easy, but if we work together, we can do more to protect our families, to preserve our cultures, and to prevent COVID-19 from taking more from us than it already has. We stand in solidarity with all agencies, organizations, and advocates who have the interest of Utah's people at heart. For information on prevention, testing, and other resources, please contact us at upihc.org. That's the acronym for Utah Pacific Islander Health Coalition. You can find us on Facebook and or call 385-202-3679. I'm sure that contact information will be shared with the press as well. Again, this issue is real. It's taken a while for some in our community and at large to come to that realization, but it's not too late. This is the time to be stronger in our resolve and to do all that we can to protect our families, our neighbors, and our communities. Thank you very much.